Turks and Caicos, similar to other countries in the Americas, they apply to PAHO for the validation of the mother-to-child transmission of either HIV, syphilis, or hepatitis B. Following the in-country process, the reports are shared with the regional validation and the global validation committee to determine if the country met the criteria, the global criteria for the elimination of the mother-to-child transmission of any of these diseases.
I can confidently say that our journey toward the elimination of mother-to-child transmission has taught us invaluable lessons and lessons that extend far beyond our clinical protocols.
Is that on admission, we have the admission process. We do rapid tests or point of care testing, as we call it, of HIV, syphilis, and hepatitis B. So upon discovery of a positive test for either HIV, syphilis, we implore the immediate treatment.
So health professionals are key. We are central to ensuring that pregnant mothers, new mothers, receive comprehensive, respectful, and timely care. Their role begins with first ensuring that we're doing prompt identification of various illnesses such as HIV, syphilis, and hepatitis B.
Every pregnant mother that comes to the clinic is being screened for HIV on her first antenatal visit. If a woman tests positive at any point, we immediately confirm the results and start antiretroviral therapy.
We've also seen how important it is to have strong systems so we can track progress and respond quickly. These lessons will help us to work together to eliminate other diseases and strengthen our clinical services. We're committed to using what we've learned to keep improving and making sure every child in TCI has a healthy start in life.
One of the most important takeaways is the power of integration and collaboration. Progress happens when our entire healthcare system, from policy to patient care, moves in the same direction.
Beyond healthcare, sectors such as education, social services, and community-based organizations have played essential roles. Public education campaigns, community engagement, reduction of stigma and discrimination, and support systems for vulnerable populations have all contributed to increased uptake of services and adherence to treatment.
I am so happy that the process has started because I was the person who started the process of compiling information. And I'm so happy that this process has started for validation to take place.
We have been on this journey since 2016, and it took a lot of effort from stakeholders, both within the primary, secondary healthcare services, as well as community stakeholders and community partners across the length and breadth of the Turks and Caicos Islands.
This recognition means that our health system is strong and capable. It shows that we are serious about protecting our families and investing in the future of our children. But we know that it doesn't stop here. We're continuing to improve on how we track and follow up with babies and mothers, making sure that these services are easily accessed. Also, we're keeping sure that our health workers are trained and supported.
Our commitment is not just clinical, it is promised to every child born in the Turks and Caicos to start life free of preventable infections. From 2013 up to today, I can tell you, having come up with a child that to say that is HIV positive.
But it is also a testament and a commendable example that we are working like a well-oiled machine for every person who resides within the Turks and Caicos Islands, and that we can be an example to others. You can do it too.
Together, we have found an approach that we feel would provide a comprehensive solution to the needs of all of these mothers here in the Turks and Caicos Islands. I'd be very proud of the team, and I'd like to say congratulations to all who have worked tirelessly over the past 9 years towards the achievement of this validation.
This achievement is truly momentous. It represents a major milestone for public health and for the global HIV response, marking an important step towards our shared goal of ending AIDS among children by 2030.
This achievement reflects strong political will and steady investment in primary health care. It also recognizes the dedication of health teams and of people living with and most affected by HIV, who work every day to ensure babies are born free of preventable infections.
This is a major public health achievement and a testament to what can be accomplished through focused leadership, science-driven policy, and strong community solidarity. Today, we celebrate not only the elimination of HIV infections in infants, but also an extraordinary milestone.
As chair of the National Validation Committee, receiving WHO certification for EMTCT is a significant milestone and a testament to the country's commitment to public health excellence. It reflects the dedication of health workers, policymakers, and communities working collaboratively toward a common goal. At the same time, certification is not the endpoint, but a responsibility to sustain gains, maintain high standards, and continue strengthening systems to prevent re-emergence. It serves as both the recognition of achievement and motivation to advance further within the elimination agenda.
I feel incredibly proud. This is a major achievement for the Turks and Caicos Islands. This shows what is possible when persons work together and we protect mothers and babies. The journey hasn't been easy, but we've done everything to make sure that the follow-ups and appointments were made. And we are proud to know that we haven't had any babies infected with HIV within the last decade. So it just speaks to our commitment as a government to work together.
And we have to give everybody involved in this process credit, because they have all worked hard and they should all pat themselves on the back. They've done a very good job. Congratulations.